Thank you, Chair. Dr. Babatunde Olokuri, Director of Surveillance, Disease Prevention and Control, CARPHA. Dr. James Hospitalis, the Executive Director, CARPHA. Dr. Eldona Bossa, Representative, PAHO WHO Representative for Trinidad and Tobago. Other CARPHA directors, invited guests, ladies and gentlemen, members of the media. First of all, I'm going to express apologies from the Honorable Minister of Health, who's unfortunately cannot make it here this morning. So I was asked, being the Principal Medical Officer of Environmental Health, and having worked at Insect Vector Control Division, Ministry of Health, for a period of about 20 years, been asked to give a couple of remarks. First of all, again, on behalf of the Honorable Minister of Health, Dr. Fawad Khan, I would like to take this opportunity to thank CARPHA for hosting this first consultation meeting for chikungunya in the Caribbean. Chikungunya has a recent history in the Caribbean, as you're all aware, with the first case diagnosed in St. Martin in December 2013. Since then, it has spread throughout the Caribbean, with the first case appearing in Trinidad and Tobago, July 2014. And I must add that this first case was diagnosed by a rheumatologist, and the person had visited St. Lucia. Since the start of the epidemic, there have been 316 confirmed cases in Trinidad and Tobago for the period July 2014 to December 2014. For 2015 thus far, there have been 23 confirmed cases and 410 suspected cases. CHIKV has contributed to significant morbidity in affected persons, especially those over 45 years of age, who suffer from the sequelae of chronic joint pains and fatigue long after recovering from the acute stage. And I extend my, I could fully aware of Dr. Hospitalis' wife having had severe joint pains, months after the initial attack. The significant economic burden of CHIKV derives from costs associated, as you all know, directly from the care of the ill persons and the indirect costs related to loss of time away from work. The lengthy post-recovery period observed can also have air effects on our human resources. In Jamaica, for example, the education system was crippled by teachers and students falling ill. Thankfully, however, in Trinidad and Tobago, due to our continued public health efforts in curbing dengue fever and other vector-borne illness, we were able to significantly prevent the epidemic in the proportion experienced by Jamaica, the Dominican Republic, and the other Caribbean islands. These public health efforts are geared to public education on source reduction, and our success is mainly due to participation of our public in keeping their environs clean. These efforts include media campaign. Most of you probably are aware, especially in Trinidad, about the Don't Get Bite campaign, which started around end of July, August, and continued until about November. This involved visual representation from the Ministry of Health, which still continues on local television, with an emphasis on education, and the main thing, really, public awareness of the possible source of breeding of the Aedes aegypti mosquito. What you can do if you suspect you have chikungunya fever, and what you should take or not to take in terms of medication. So there were already two phases. From July to November, the public was again reminded about chikungunya, what it is, how we can get it, how we can prevent it. And then from November onwards, the legislation part was enforced, meaning to say that the public has been advised to report any persons who suspected of breeding the mosquitoes. And The first part, including Granny, was talking about chikungunya. The second part, we're talking about the delinquents. In other words, those individuals who are breeding their mosquitoes in their backyard. It also involved the use of print ads as well as mailing of over 250,000 brochures to our public with essential information on chickpea, dengue, and eradicating mosquitoes. The chickpea bus tour, which visited over 18 key areas, and at those areas, mosquito nets were distributed, zappers, and wristbands. The Ministry of Health continues to have intersectoral meetings between the regional health authorities and local government with the aim of strengthening our cleanup campaign. Again, I emphasize that the key or the solution to getting rid of these mosquito-borne illnesses is to getting rid of the source reduction and mosquito eradication activities, again, as I mentioned, by our Insect Vector Control Division, are ongoing. Whilst we continue with our health promotion exercises, the Ministry of Health has also embarked on the following additional source reduction activities. Recently, Insect Vector Control Division, we have started using the one species of the Bacillus thuringiensis from Cuba known as Bactivec. Also, we have acquired surface rowing agent Aquatine, and that has, I think, arrived in the country and is now being used. Tomorrow afternoon, Dr. Raghu from the Insect Vector Control Division will be talking more about the Into-Care mosquito trap, which we have done a trial. And pretty soon, I mean, we use regular bed nets, but the additional use of impregnated bed nets. These products are environmentally safe and are used in Cuba and other countries and have shown to be highly effective. Hence, there are no ethical concerns with their usage. We recognize that in the small island of Dominica, there have been no reported new cases of chickpea over the last 2 weeks or so, and we applaud their public health efforts. Though we have been able to prevent a large-scale chikungunya epidemic thus far, our continued measures with collaboration with other vested stakeholders, as well as public commitment to prevention, are vital in eradicating chickpea, dengue, not forgetting malaria and yellow fever. Prevention of the latter is also due to the readily available yellow fever vaccine. And I'm now recognize that, I mean, we're talking about chickpea, but malaria is becoming a bigger problem because of the growing drug resistance today. The Ministry of Health is steadfast in its prevention campaign, and we at the Ministry are also keenly following the recent outbreak of Zika fever in the French Polynesian island, another mosquito-borne illness similar to dengue and chickpea. These illnesses have no cure, and once we have eradicated the source of these illnesses, they will no longer pose threats to our health and productivity. I look forward to this consultation, which shall assist us in strengthening of our surveillance methods, improving our diagnostic capabilities, providing new evidence-based information for clinical management, and improving on our vector control strategies. Again, on behalf of the Honorable Minister of Health, I thank you, and I express, again, wish to thank CARPHA for hosting this important consultation. Thank you.